Hi guys, Dr. Michael Unive here from Breast and Body Clinic. Today I wanted to talk about a question that pops up on the minds of many patients, particularly when you're going through research and you're thinking about breast reduction. You often think about, well, how can I avoid the scars of the breast reduction, which sometimes can be large in some cases. And one of the ways that breast reduction scars can be avoided, of course, is by not putting any in there, and that means using something else other than surgical excision to achieve the reduction. This can be done, and it can be done by liposuction. So liposuction of the breast is something that is used and can achieve a reasonable result. So it all depends what you're starting from and what you're happy to accept at the end. Most patients, when they're planning for breast reduction, it's usually not just the reduction but also a lift part of the operation, that is repositioning of the areola and the nipple into more useful position. It gives a more useful appearance of the breast. This is what many patients are looking for, not just the reduction in the volume per se. However, if you do have a large breast but the position of the important markers such as the areola is all in the right position or very close to it, then liposuction could be a good option for you. It could definitely reduce the size of the breast, particularly if the breast is quite fatty, because remember, it won't work on the breast gland, but it will work on the fatty tissue. And this, in many cases, can reduce the size of the breast between 1 to 2 sizes most of the time. So it is not an unreasonable option. Now, in terms of surgical excision, where you actually have to remove part of the gland and reposition the areola, then everything depends on how much breast tissue you have, how big the breast is itself, how much of the lift is required as to what we're trying to achieve. And the scars that we choose are based really to design and serve a purpose, a particular function to achieve those objectives. So there are different types of breast reduction, as you may have read: the circumareolar scar, the lollipop scar, and then the anchor incision, where you've got all 3 scars together. The type that you will end up with will depend on exactly what you need done and what the result that you're looking forward to. In many cases, the scar's visibility can be reduced by placing an incision in the appropriate places, like for instance in the inframammary crease, where once the breast settles, they're actually not very visible at all. If you speak to patients who've had this procedure, when the patient looks down, really all they're seeing is an incision around the top of the areola. You look in the mirror, you're seeing the lollipop scar around the areola and down into the breast. And this fade very well over time, and a couple of years down the track, they really become not nearly as badly visible at all. And as I've said, the inframammary incision can be very well hidden away in the crease itself. So using the natural positions of the body can really help to hide the scars very well. The healing that takes place over time will fade the scars, and they will not be as pronounced as they are initially, by no means. And of course, using other methods such as liposuction, if it is appropriate in your case, can get rid of the scars completely. So I hope that this answers some of the questions that you may have had burning on your mind, and helps you decide whether to go ahead with this procedure or not. If you have any questions, please feel free as usual to send us your pictures or ask us a question, and we'll answer the best we can. I look forward to speaking to you again soon. Have a good day.